Hello there, it's Dr. Jim. I'm back, and thank you for joining me for another session. Today's topic is something that I've been studying for a long time. I have books all over the place on this particular topic, and it's neurotoxins and their role in neurodegenerative disorders. This is important stuff because there are schools of thought that are telling us toxins and neurotoxins in our environment, in the workplace, in the fields, in nature, in cities, in suburbs, are the root causes to some neurodegenerative disorders. That's alarming, it's frightening, and it's something that we have to pay attention to. So allow me to present to you what I've learned about this topic. As cases of various neurodegenerative conditions like Alzheimer's, Parkinson's, and other related, dementia-related diseases increase, they're not decreasing, by the way, they're increasing. There's a surge in research examining the effects of exposure to neurotoxins, pollutants, and their bioaccumulation in our bodies and in our brains. The Centers for Disease Control, CDC, reveals that many people with such conditions have been exposed to a variety of toxic pollutants, including heavy metals, flame retardants, pesticides, solvents, pharmaceuticals, and good old-fashioned air pollution. What is the connection between these toxic substances and neurodegenerative disorders? That's the question that I was interested in. That's what I researched. Let me discuss, first of all, what neurodegenerative disorders are so that we're all on the same page. Neurodegenerative disorders are conditions in which cells of the brain and the peripheral nervous system lose function over time, they stop working, or they die altogether. The most common neurodegenerative disorders are Alzheimer's, Parkinson's, Huntington's, MS, and ALS. While there are a variety of medications and other treatments to help manage with symptoms, there's no way to significantly slow the progression, and there are no cures. So, those are neurodegenerative. Now, what are neurotoxins? Greater attention is now being paid to the role of neurotoxins and other substances which may, in the formation of certain neurodegenerative disorders, cause us a lot of illness and disease. Simply put, neurotoxins are poisons that are destructive to nerve tissue and disrupt the normal functioning of nerve cells throughout the body and in the brain. As this process takes place, we see symptoms starting to develop. Here are some examples I found of neurotoxins that do cause neurodegenerative disorders. Overexposure to formaldehyde, methanol, and the toxicant DDE are all linked to increased risk for Alzheimer's. Overexposure to mercury, aluminum, copper, or lead are linked to memory problems and certain forms of dementia. These are scary findings. Okay, now this is history and a finding. Chamorro villagers who live in Guam used to eat the flour from seeds containing a substance called BMAA, which is an environmental toxin. What happened to these villagers who ate and made breads and other things out of this flour? They developed ALS, Parkinson's, and other neurodegenerative disorders. Use of certain anesthetic agents and the overuse of benzodiazepines, that's scary, are associated with neurodegenerative conditions. Do you know someone? Are you someone who uses benzodiazepines over extended periods of time? I know you've heard this commercial, it's everywhere. Paraquat, one of the most popular pesticides used around the entire planet Earth, is now believed to be behind the dramatic increase in Parkinson's disease cases. Here's some risk factors. People who are exposed over lengthy periods of time due to their job or perhaps serving in the military, they run a higher risk of developing certain neurodegenerative disorders. Some toxins may be in the environment or they're eating or drinking them. They cause a condition called toxic encephalopathy, which can deteriorate an individual's mental abilities for either a short period of time or chronically over a long period of time. Risk factors include the following. Being exposed to the following. Let me take a drink real quick. I'm talking too much today. Go figure. Dr. Jim talking too much. Heavy metals, including mercury, lead, arsenic, lithium. Pesticides for long periods of time. Cyad, a seed in the Western Pacific. Certain psychotropic and illegal drugs. Flame retardants. Solvents. Air pollution like nitrogen dioxide, secondhand smoke, and carbon monoxide. And substances called plasticizers. These are used to make so many things that we are absolutely surrounded by. Vinyl flooring, clothing, hoses, and wires. Here's some signs and symptoms of exposure. Although signs and symptoms of neurotoxicity are going to differ from person to person, there are some common things to look for. Fatigue and lethargy, memory loss, confusion, difficulty concentrating, depression, increased irritability, uncontrolled physical movements and twitches, and changes in behavior and personality. These symptoms can be easily confused with the most progressive dementias that we're aware of, and it might be difficult to trace the exact cause of dementia from such toxins. In many cases, it's going to be a mystery until it's too late. Unfortunately, I hate to say that. Some of the more short-term symptoms include a headache, nausea, dizziness, and lightheadedness. A note on treatments. Different treatments do exist depending upon the severity and the intensity of exposure to these substances. While there are no cures, some of the physical side effects can be managed through dietary changes, nutritional supplements, the use of anticonvulsants, and sometimes even full organ transplants are necessary, so surgery. Some experts believe that L-serine may be effective in treating Parkinson's disease, ALS, memory, and other cognitive conditions, but ask your healthcare practitioner. Here are my final thoughts. Is it a coincidence that an increase in the use of many toxic substances used in the United States and around the world is occurring at the same time that there is a dramatic increase in many neurodegenerative conditions? While some would argue that neurodegenerative diseases, like Huntington's in particular, are caused by some genetic mutations, and they would be right. It's possible, though, that neurotoxins and other toxic substances can be placed into the context of possible genetically determined susceptibility. Toxins make me more genetically susceptible to developing a neurodegenerative disorder? Who knows? The answer could be yes, the answer could be no, it could be somewhere down the middle. I don't know. But what I do know is this is a serious topic. I hope you keep learning about it. I hope you protect yourself and others as much as you possibly can from neurotoxins, because they can be deadly and cause a lifetime of pain and suffering. Thank you for spending some time with me. I'm Dr. Jim, and I hope to see you back soon. Thank you so much for taking some time to watch the video. I appreciate it. And if you're a licensed healthcare professional who's looking for some great continuing education, we've got it. And we are always working on brand new, fresh content for you. So you can find the link to the website in the description, and keep coming back for more information. I hope to see you soon.